Hey guys, welcome back to another Surgical Tech Tips. You will notice I am back to babyface Shane. I had to shave my beard, and that is the whole reason for me making this video. I had to shave the beard because it's my birthday month this May, and with my birthday month comes having to take my TB test, a blood test at the hospital, and my TB fit test with the TB mask, respirator masks that we use in the OR if we have any TB patients that we're working on inside the operating room. So this year it seems like they're really focusing in, or OSHA, O-S-H-A, OSHA is really focusing in on facial hair on males with respirator that are utilizing respirator masks. Now, the mask that we wear, you've seen previously in my my other mask video, and they're essentially saying that there should be no facial hair in contact with the mask itself. So people that just have, like a little mustache or a little goatee, and it doesn't affect the seal of the mask itself, they're okay. But for me, I had a beard across my whole face, and that affects the seal on the mask, so I had to shave it off. Now, I love that beard, and I really wanted to dive in a little deeper into why OSHA has that regulation, and dive a little deeper into exactly what tuberculosis is and why OSHA is protecting us as medical professionals. And with all that research, I just wanted to make this video and share it with you guys. So here we go. Now, first things first, I just want to explain what tuberculosis is, and I'm going to have the assisted help of this sweet book I got probably a couple months ago. I started reading it. It's called Disease: The Extraordinary Stories Behind History's Deadliest Killers. It's a very, very cool book that goes over things, like the plague, leprosy, syphilis, cholera, typhoid, tuberculosis, fever, all sorts of different diseases of our history. And it's a really, really, really cool book. I'll put a link in the description for you guys. And I think at some point, when I'm done reading this book, I'm like halfway through it right now, but as soon as I'm done reading this book, I might do a giveaway as well, and give it out to one of you viewers out there. And maybe you'll enjoy it just as much as I did, because this is pretty cool stuff. So first, let me take you through a little history lesson of what tuberculosis is, where it's been in the past, present, and what we can kind of see in the future. So tuberculosis is obviously, it's a chronic bacterial infection, and it's had a huge variety of names in its history, like scrofula, phthisis, consumption, graveyard cough, and even the White Death. Now, the most common form of tuberculosis that we see nowadays is pulmonary tuberculosis, and obviously that affects the lungs, and it's transmitted through airborne or droplet, which basically means anybody can cough or sneeze on you and you are able to contract tuberculosis. What's really sad, though, is that TB is now one of the greatest single infectious killers in the world. An estimated 2 billion people, nearly 1/3 of the world's population, are infected with TB, and 8 to 10 million become ill, and 1.5 to 2 million people die each year still from tuberculosis. Now, I really wanted to see where most of the deaths occur, and it seems like, according to Wikipedia, most of them are in the developing countries. 95% of those deaths actually come from developing countries like India, China, Indonesia, Pakistan, and even the Philippines. Now, as a medical worker, obviously we can be exposed to a tuberculosis positive patient. In my 10 years of working here in the US, I have worked on one TB positive patient, and obviously everything went well because I'm still negative. But there are, regulations and testing put in place for medical workers by OSHA and the CDC to ensure our safety. So when you are hired on at a medical facility, they will do a baseline TB test, and it could be either a 2-step skin test or blood test to signify whether or not you are positive or negative for TB. And every year successively after that, you will have to take a TB test, either the two-step skin test or the blood test, every single year, no matter what. My hospital does it on our birthday months. So, my birthday month is this month, May, and I have to go into my employee health and go get my blood drawn for a TB test. Now, to add on top of that, we also do a fit test. And the fit test is to fit your N95 respirator mask over your face. You guys have previously seen that on the mask video that I've done. But we do that TB fit test every single year when we do the TB test as well. Now, the two-step TB skin test is a little different than the blood test. The skin test is what actually we previously used to do at my hospital. They just recently started to draw our blood for the tuberculosis. But we previously did the two-step skin test, which was essentially them injecting us into just in the skin layer, and we'd have to come back 2 days later to see if there was a reaction to the skin.
You will feel some resistance as the tuberculin is injected. Placed correctly, the injection will produce a wheal 6 to 10 millimeters in diameter.
I guess they told me this year that for generations that have previously had the BCG vaccine, that there have been some false positives for people that have that two-step skin test, saying that they might actually have a positive reaction to tuberculosis, when in fact it's a false positive because they had the vaccine for it. So I think they're putting in place that my hospital is doing the blood test because it's a more definitive answer, and it's a quicker answer as well. It's not a whole 2-day process. Now, the fit test is pretty simple as well. You basically pick out which size respirator mask you're going to be using, the N95 mask you're going to be using that fits your face. The nurse will fill up a little spray bottle full of saccharin or some other type of fluid. Saccharin is like a sweet airborne substance that she sprays at your mouth, and if you can taste it, then she has you don your mask, your N95 masks, and she puts a hood on top of me, and she basically has the sprayer in the hood and asks me to turn my head left and right, up and down, march in place and count to 20, bend over. She's basically doing that as she's spraying the saccharin in my hood to ensure that I have a nice tight seal across my entire face and that I have the right size N95 mask. After all that's done, you take everything off, and if you don't taste that sweet saccharin in your mouth, then you have a proper fitting N95 mask on your face. Now, what started this whole process of me researching all this stuff and looking into everything was obviously because I had to shave my beard. They had multiple posts and pictures all over my employee health stating that everybody needs to be cleanly shaven across the mask line to ensure a proper seal, and this was all pushed by OSHA. And I went online, I went onto the OSHA website, and I looked into it deeply, and this has been going on, I guess, like the combat of is an N95 mask okay to use if you have groomed facial hair, or is it not okay? This has been going on for years and years and years and years and years, and I think they're probably getting tired of questions about it, and I'm sure that's why they're pushing a lot of this no facial hair for fit testing. Now, the more and more I dug into it, the more and more curious I was to see if there was something that we could use in the OR if you do have a beard, or for someone that does want to keep their facial hair. I wasn't okay with someone telling me that I just cannot have a beard if I'm going to be working in the OR. So, in fact, there is. It's called the PAPR, or PAPR, ventilation system, and it's an actual air purifying respirator that you can clip onto your back of your scrubs, put a disposable hood on, and basically have this air purifying respirator over your whole head and face in a TB case. So I just wanted to share that with you guys because I thought that was really cool. I'm the type of person that if somebody tells me no, I want to find out why it's no. So I did my research, I looked up a lot of information on it, and I'm going to be taking this information to my director and to my employee health, and I'm going to see if we're able to get these purifying respirators for our hospital. So I've always been told it's important to question everything, especially if it's something that someone just told you, even if it's coming from a regulatory body like OSHA. It's important to research it for yourself and really find out why. So I hope you guys enjoyed this video. I know I enjoyed the research into tuberculosis and the research into finding something that I can possibly use in the OR and possibly get to keep my beard, because I do not like this baby face at all. I really got used to the beard. Alright guys, thanks for watching. I hope you appreciate the video. Bye.